Hello, I'm Dr. Kenneth Moore, part of the Val Verde Regional Medical Center Urology Department, one of the two urologists here. And I've been asked to talk a little bit about some newer technology that we have here at the hospital and ways it can benefit folks here in the local community, and specifically involves some laser technology that we have here that's very state-of-the-art and that we're very proud of. And so today is a good day to talk about that just a little bit. Well, to begin with, it's kind of important to know what a laser actually is, and then we'll kind of talk a little bit about the different procedures we can do with the laser and why that's a benefit to patients for various problems. As time has gone on, lasers are made of lots of different materials, but the one we use here at Val Verde Regional Medical Center is called a holmium yttrium aluminum garnet laser, which is kind of a mouthful, but basically it's a little crystal solid state unit that uses light to treat kidney stones, stones that are trying to pass from the kidneys, bladder stones, prostate problems, scar tissue, even tumors in the bladder. It turns out that's a very safe thing to do, and lasers have been in use in medicine for probably 25 years, but as it turned out in urology, lasers really came into use around the year 2000, 1998-2000, when we had developed a wavelength that would be absorbed by stones and dissolve kidney stones for us. So knowing that a laser is all one specific wavelength, our luminous 120 watt laser that is a holmium laser actually has a wavelength exactly 2100 nanometers, which is 2100 billionths of a meter, which is pretty short, but it's actually longer than visible light. So it's infrared, it's invisible, and the beam can't be seen, so we use a little green finder beam with it so we can see where the laser is pointed. That particular wavelength is really versatile and useful in medicine because it's absorbed by water, and most tissue in the body is water. So scar tissue, tumor tissue, overgrowth of prostate tissue, those things are all absorbed specifically by this wavelength of laser, and when it heals afterwards, it's particularly gentle healing. It doesn't cause a lot of trauma to the tissue, so healing is faster and pain is less and recovery is faster. The really interesting thing though about our holmium laser is that it's also absorbed by stones, because it turns out kidney stones and bladder stones also have a fair amount of water, even though they're hard and sharp and painful. And the water in these stones absorbs the laser light from our holmium laser and really just powderizes them. They don't blast apart, so it's not violent. It just sort of dissolves them gently, and it's a really, really nifty method of getting rid of kidney stones. And our goal is, to go from the old days of, taking out a rib and removing part of a kidney to get your kidney stone out in 6 weeks of recovery time, to shockwave lithotripsy, which was a little better, where they blast the stone into pieces and they have to pass, to now with fiber optic instruments and scopes, and with the lasers we can work through the natural openings of the body, have no incisions, and really minimal discomfort and very quick return to work and quick recovery time. So our particular unit, as I mentioned, is 120 watts. It's one of two right now in the state. It was one of the first two in the state of Texas, and it is the state-of-the-art holmium laser machine. It's really it is the best holmium laser machine made in the world today, and we're proud of our unit. We take kidney stones out with the laser, ureteral stones when they're stuck between the kidney and the bladder, and larger bladder stones, which are pretty easy to address with the laser as well. And as I mentioned, scar tissue, when there's a blockage in the urinary system, this laser does a wonderful job of removing the scar tissue and opening it so urine can flow like it's supposed to, with very, very minimal bleeding and pain involved. Predominantly, we're just very proud to have such a cutting-edge technology to use in the Del Rio area, because there's really not better equipment really anywhere, no matter how large a medical center you choose to go to. And the idea that we can have you treated and be near home and get you home as quick as possible, I think is valuable to our patients, because no one wants to be out of town to recuperate, and they don't want to make travel arrangements to follow up with their doctors. They'd rather stay, I think, with people that are local. And our crew that helps with laser surgeries here has really learned well. They're a very well trained crew, and they take great pride in the fact that they can use this laser unit well as a team, and our patients do very well. So I think as time goes on, more and more patients will choose not to travel far away to go to bigger facilities to have not necessarily better equipment for their surgery. So please feel free to come visit our urology clinic. We're located inside the hospital here, right next to the emergency department.